Sawadika and hello again. My name is Mญาต and welcome to this special editions of News and Views, which is usually on air at the same time, 6 to 6:30 p.m. every Monday. And right now, today, I have with me Professor Gian Carlo Di Renzo. He is the chair of the University of Perugia, as well as the director of the Reproductive and Perinatal Medicine Center. And I have him with me right now. Sawadika. Thank you for being with us today.
Sawadee, good afternoon.
Good afternoon, everybody.
Privileged to be here with you today.
Okay, so thank you once again for being with us on News and Views. Like I've said before, the News and Views is like an English program from the ministry, which is on air every Monday from 6 to 6:30. So today we'll talk a little bit about you and what you do for a living, because like from your biography, I see that it's a long list. So before we begin, I would like you to introduce yourself to everyone so that we know more about you.
Okay, I was born in Verona, north part of Italy, but now I live in Perugia. As said, I am a chair in the Department of Obstetrics and Gynecology and also the Reproductive and Perinatal Medicine Center. In Perugia, I'm already 20 years, but my recent activity is linked to the International Federation of Obstetrics and Gynecology, which is based in London, when I became the Secretary General of this big federation. Moreover, my activity are also to teach in other universities of Europe and out of Europe, and I'm consistently doing a lot of research activity in the area of maternal fetal medicine.
Okay, so do you have any well-known work that we should know about? Like journals or any research that we can do?
I run as editor-in-chief one particularly well-known journal in our area, which is the Journal of Maternal Fetal Neonatal Medicine, and I have intense activity in publishing books and in lecturing in many congresses around the world.
Okay, that sounds very interesting. So you get to travel around the world a lot, right?
Yeah. Also, particularly my area of interest is this part of Asia, because I will tell you in a moment, through the FIGO, the International Federation of Obstetrics and Gynecology, many activities I'm involved with, and South America, which is another area which I'm particularly involved in teaching and training people.
Okay, so you mentioned FIGO. What is FIGO exactly?
Yeah, this is a big federation, probably the biggest in the area of medicine, because we are comprising 135 national society.
Right.
Among which also the Royal Thai College of Obstetrics and Gynecology. And this association was founded on 60 years ago, and is more or less formed by more than 1 million obstetricians and gynecologists in the world.
Right.
Our mission is mainly dedicated to the woman health, so fighting the inequities, giving the most of the rights to women, and running projects which are useful to decrease particularly the maternal mortality and infant mortality in the world.
Okay.
At the same time, we are interested in raising the standard of our profession. So we have big programs of teaching and training through congresses, through website, through books, and through any activity that, of course, nowadays can be useful to reach the people and to raise guidelines, advice, and so on. And this, I think, is our main mission, and we are particularly, a big society which is based in London. And of course, there are many activities which are going around with this federation.
Okay, so the main office is in London, so you have any other offices around the world?
The office where I work is secretariat is London. Then we move according to projects in other areas of the world. We have a big project, for instance, in Sri Lanka, in Indonesia, and in Africa, mostly in some countries in Africa like Malawi, Nigeria, Kenya, and in South America, particularly in some areas of South America like Uruguay, Brazil, and Ecuador. And not really office, but we use as office the National Society offices, because we are an ensemble of National Society. So we can take the National Society as our hub, for instance, in a region, to implement projects. We have still going on, I think, around 10 projects which are funded by the major foundation and non-governmental organizations in the world, like the Bill Gates Foundation, the Canadian Challenges, World Bank, and so on. We are preparing this project, we negotiate with them, and then we implement the project through the national society members.
Okay.
And this is particularly, let's say, practical, because we usually achieve a result in a very sensitive way. Because, you know, speaking to our colleagues around the world is much more easy to implement other projects which are, you know, more not dealing with the doctor, which are dealing with the maternal infant care. And we have projects which are dealing with contraception, with the safe abortion, with protection of women's rights, especially to decrease maternal mortality after delivery, postpartum hemorrhage. So are all projects which are running in many parts of the world with, I would say, very good result.
Okay. Before FIGO was founded, is there a history behind why FIGO was founded or established 60 years ago?
But I should say that there were already since 20 or 30 years, because the association of medical doctors start to be, let's say, created at the beginning of the last century. Some at the end of even 19th century, but the majority at the beginning of last century.
Right.
And this association has rise mainly in countries which are very well organized from a medical point of view, like a Royal College of Obstetrics and Gynecology in United Kingdom, the American College of Obstetrics and Gynecology in the United States, Canadian College, and so on. Then Europe was the main motor, the main driver to create this association. In fact, the association was created in 1954, if I'm correct, in Switzerland, in Geneva. And as usual started with a few people,
Right.
which were represented some societies, and there were at the beginning 45 societies who joined the FIGO.
Right.
But then in few years, now we grow up to 135, and soon will be around 140.
Okay.
Our Congress is, let's say, PAN Congress, World Congress, is every 3 years, and this year will be the year of the Congress, 2018, in October, in Brazil, in Rio de
Brazil.
Janeiro.
Okay. So 135.
But we rotate every 3 years in
chairmanship.
different regions of the world.
Okay. So have you covered every region of the world yet? For
Yeah,
members
every
of the
region,
FIGO?
yes, but not every
Not every nation,
big
of course
cities. We wish to have congresses in the main city,
Right.
especially where there are a lot of attraction, not only from a scientific point of view, but also social attraction, and also to rise let's say, the international level of a particular association in a particular country.
Right.
So usually the bid for congresses are presented by 4 or 5 countries in that particular area, and then there is a votation by the General Assembly. Decisions are taken for many reasons, usually also economic reasons. FIGO rely also on the Congress to survive, to maintain its office in London, and also to apply for its activities around the world.
Okay. So any major achievements for the past 60 years for FIGO?
Yeah, I think that FIGO has achieved something that is very important. As always interacting with the World Health Organization, we have achieved major results in decreasing maternal mortality worldwide,
Okay.
particularly the one related to pregnancy and delivery. We have introduced a wide number of hospitals in Africa which are capable now to fight and to treat fistula. You know that obstetric fistula is a very big problem in many areas of Africa due to the unattended delivery and the laceration that can come after delivery.
Right.
And these women, which are very young, suffer, and they sometimes are rejected by the community.
Right.
And there was nobody in the past to do this. And FIGO took over already 15 years ago this topic, and has created a center of training and teaching for surgeons
Right.
because and nowadays I can say that 2 months ago was already achieved a 6,000 patients treated by the FIGO based hospital. So 6,000 women were being relieved by this burden, in particularly in African countries. Moreover, we have introduced safe technology for abortion in many countries, and this is another big achievement. And we have at least rise in the last year in many countries the awareness of many problems in our profession, fighting against the major problems in the cancer. For instance, particularly a knowledge to FIGO is the classification of woman cancer, the genital cancer. The FIGO classification is worldwide recognized,
Right.
and either the major scientific society in the world, like WHO and so on, adopt the FIGO classification for tumors. We have reviewed recently the classification, but this is very important because classification allows comparison
Right.
and epidemiological data, audit of what is happening in a country. So we know if in a country some prevention of particular cancer like cervical carcinoma can be prevented fighting against some infection, for instance. And this is some achievement that FIGO has reached in the last 50 years, I
Okay.
think.
So for each training, so how many physicians that you usually have trained every year under FIGO?
But you know, we cannot say how many because it's open, free to everybody to attend
okay.
FIGO courses.
Right.
And we have either a website which is free, which is attended every month by more than 1 million people. So it's
Wow.
viewed by more than 1 million people every month.
Oh, wow.
And this is what we call the Woman Library, provided by FIGO.
Uh-huh.
Was created by an independent person, Mr. David Bloomer and his wife, and then was donated to FIGO. And this is a huge website with textbook, master classes, videos, in which everybody can be updated in a particular technology of interest and so on. Second, we raise regional congress in different regions,
Right.
jointly with FIGO, and we organize also session at the National Congress providing FIGO intervention in sensitive topics. Usually our sensitive topics are maternal infant medicine and the prevention of gynecological cancer.
Okay.
This is the major concept. Of course, contraception
Right.
and family planning.
Right.
And this area are particularly interested. So if a national society asks FIGO to organize a particular day or course, we are always ready to do that. So it is why my activities go around the world a lot, because we have a lot of requests to organize meetings and so on. So I think that attendance to FIGO is rather very high every year. Okay.
Do you expect the number to go higher?
I hope so, because this means that we are working very well.
Right.
I think that probably the individual participation will not be growing too much, but I think the social, mediatic, and the, let's say, what we call now the website participation will be rising, and we hope that will be rising. And what we are looking now is to we create a specific department of education in which we also try to, at least the major master classes, the major video, major area of interest, to be translated in several languages,
Right.
in order that we be more accessible to everybody, because otherwise the languages of FIGO have been traditionally English, French, and Spanish by foundation. But you know, we have many other languages. Just to look into China, Chinese or Arabic country and so on.
Right.
How many people are there,
Right.
and how many gynecologists, how many women may have interest. And also we are opening now a special forum for women of all the world that can approach FIGO for knowing more about themselves, to make awareness. FIGO thinks that the woman empowerment
Right.
in many countries is the key to ameliorate the health system for women, at least. And women should be knowledgeable of what they can have I give you an example.
Right.
50 years ago was introduced the immunoprophylaxis for RH disease. I don't know what is the RH disease, but RH is a particular feature of our blood. Okay? And a woman may have this RH positive or negative.
Okay.
If they are negative and they marry a man with RH positive, its baby can be negative or positive according to the fact that match the genes.
Right.
But if the baby is positive in utero, when she delivers the first baby, she may have a transfer of blood from the baby which start a reaction from the mother against the RH factor.
Okay.
So in the next pregnancy, this develop a disease which is particularly harmful, creating either abortion or creating a severe disease in the baby, which are usually dying at birth or soon after, or remain major handicapped. This is called RH disease, okay? Immunization.
Right.
50 years ago, two independent investigators from the United States and UK introduced the immunoprophylaxis, which in many countries has completely made disappear this problem. But in many other countries, this problem is still alive because either the people, gynecologists, forget to control this woman, so they are born and nobody does the appropriate prophylaxis. Either there is a shortage of the drugs to be given.
Right.
So this, I think, is very important, that not only we as FIGO make awareness about this problem, but also the woman understand what problem they can have according to their blood type.
Right.
Because if a woman has a RH negative blood type, she can go to the doctor and say, "Oh, doctor, I may have a problem in pregnancy. Please take care of me." You understand? And this is important, just to give an example.
Right.
But there are many other examples we are trying now to promote through not only obstetrician gynecologists, rising therefore their professionality and giving standard and advice how to better work in their profession, but also to try to convince women that they have to be aware of themselves, of the major problem they may face.
Right.
Because just asking to the doctor sometimes, they may save a lot of problems.
Right.
Okay?
That's good, because I think that it's important to not, I think everybody, it's important for everyone. I don't think it's not just even for the women to know what their bodies can do and what can be prevented in case of, I don't know, pregnancy or other complications afterwards as well. So I think it's very important, and I think it's very useful for what FIGO is trying to do. So I think we should switch to come back closer to home, like what FIGO is doing with Thailand. So could you explain to us about that and the history or the past projects that FIGO has been working with Thailand?
I would say that, of course, the Royal Thai College has many, many years that is associated to FIGO. But the interaction between the Thai College and FIGO is not so many. Right. I would just remind one congress which was organized by Professor Kem Heng in 2013, in which FIGO took part. It was dedicated to women's health. Subsequently, one very distinguished member of your Royal College, an obstetrician gynecologist, which was Vibulpan, Madame Vibulpan, she got the award from FIGO for the merit as a distinguished gynecologist in her country and around. Then, more recently, we have interacted with some of your experts, particularly in some area like maternal-fetal medicine. And in this occasion, Professor Buzir was one of the persons that was hired by some committee of FIGO for expertise in specific area. But I would suggest that we need more input from the Thai College, also because, as I said, now our target is to ameliorate profession in country in which still, the profession of obstetric gynecology is taking, the birth. For instance, you have very near by country, which is Laos, in which the Thai college can have a big influence in teaching and training.
Right.
And FIGO can take the Thai college as a tool, an arm, to implement the teaching and training in this country. And the same can be in Myanmar or in other countries.
Right.
So I think that this is important because you have a very long tradition of very good obstetric gynecology in your country.
Right.
Very good school, very good resident program, so on, which don't have the other country around. And this can be associated by our efforts to homogenize better our association. Otherwise, we have very good in some country, nearby country very low, and so on.
Right.
Something like that.
So do you have any future plans with us that you
Yes.
have talked with people?
Yes.
Okay.
What we hope is that the representative of Royal College, when they will come at General Assembly, we will stimulate any nation, therefore also Thailand, to propose names of people that can be part of these projects. And taking into consideration the people that the Thai college may indicate as people that have a knowledge, they are renowned at least over the border of their country, in fertility, maternal-fetal medicine, gynecology, oncology, and so on, they can help FIGO in rising the standard in your area, because you know better than us in London what are the needs of this area, of course.
Right.
And therefore, this is the interaction that we need. So the association can give a lot of power, can bring a lot of teaching material, but these can be titrated according to the needs of the area.
Right.
To try to understand the people that if now, for instance, we should screen for something, but the screening should be adapted to the local way, and maybe that we need some steps before to arrive to a general screening as we do, for instance, in other country, in Europe or in the United States. This, I think, is very important. And I look forward for more cooperation with the Royal Thai College in this sense.
Does FIGO usually provide funding to any projects or programs around the regions or around the world to carry out such training programs or projects or anything connected to gynecology or obstetrics?
I would say not directly FIGO, but FIGO asks funding for participating in a given project.
Right.
This funding are provided usually easily by the foundation, private foundation also, private donors who give us the funding for creating this project, implementing this project. So what we usually do is to define with the local national society which are their major interests in 1 or 2 or 3 areas. Then this area can be either a project of our, bringing something new in the profession. So going there and training the people to do something new, for instance, surgery or infertility or in maternal-fetal medicine or in making ultrasound, technologies and so on.
Right.
And the other is general, training, education practically. Right. And these 2 things can be easily supported. So sometimes it is also the national society which provide at least the facilities. But we provide all the other things and also the money needed, of course. Yeah, this is a big advantage of having FIGO as a partner.
Okay, so you might have heard that Thailand is planning to become a medical hub right here in ASEAN, in the ASEAN region. So would you be able to evaluate our advantages and disadvantages on that and how we would be able to achieve? Do you have any suggestions on that? The becoming a medical hub in the region?
I think that in some way, I always have seen Thailand as a hub for the neighboring country in this area, because the delivery of care in some area, at least of specialties in medicine, is a very high standard. And I would say that being acquainted with your country and your obstetric gynecology since many years, at least 15 years, the quality of the obstetric gynecology of here is very good and very high. So I think that in this respect, Thailand really can be a hub, which from our point of view is not only to, educate or to provide care, but what is very important is at the end we should have audit of what we do. So we should have follow-up of what we do.
Right.
Does mean anything, or at least it's very limiting to provide something and not to know what is the feedback of something.
Okay.
So I think that it's very important. This is the reason why Thailand, which is much more organized by the other country around, can provide all the tools for the feedback. For instance, if we tomorrow implement the screening for cervical cancer in a country like Laos,
Right.
okay? We don't need only to see the way how to provide the screening with you. You have very similar language, you can teach very well, you can send even doctor there to show how to practice this. But we should have also the feedback. We should see that in 3, 4, 5 years we detect the cancer and we decrease the mortality for the cancer,
Right.
and the woman will benefit from this. And the same for maternal mortality for delivery. We know that nearby this area there is a very high mortality of women because especially in rural areas.
Right.
Okay? Because still many deliveries arrive in the very rural areas, not in hospital, and sometimes unattended.
Right.
And another area which is of interest to FIGO is to fight prematurity. In
Prematurity.
every country, especially in this area, at least more than one pregnancy every 10 and before term. So with the small babies. Babies will sometimes die or sometimes have very big handicap because they cannot be cared too well. And they
Right.
cost a lot of money.
True.
Cost a burden for families and so on. So I think that these are areas in which your country can have really a role to pilot the neighborhood one.
Right,
Okay?
becoming a medical hub. So we
Yeah.
are very, very strong in the gynecology
Yeah.
perspective. So you think that we can just boost this up and then help it
Yeah.
reach our goal of becoming a medical hub. Okay, so on to some more relaxing topics. So how many times have you been in Thailand?
Since the last 15, 16 years, almost every year. Sometimes 2 times.
Okay.
Either because I was invited to the meeting, either because I teach, either because I want to stop to have a couple of days and relax because it's a beautiful country. So we may choose some island or so on. In
Okay.
between, flying from Philippines, coming back to Europe, I can stop over around here.
Okay,
It's
so what-
my preferred area.
Okay, so the longest period that you've been in Thailand just for fun or vacation?
No, I've been for several reasons. I think that I stay here even a week or so. Usually when I combine my, scientific duties with 3 or 4 days of holidays, and then is the longest period I stay. But I always enjoy food, atmosphere, people. It's so enjoyable.
Okay, so you say you like everything. So what's your favorite fruit? Thai food.
My favorite is mango.
Your favorite Thai food is mango?
Mango, yes. And my favorite dish,
Oh, right.
it could be strange, but is mango sticky rice.
Mango sticky rice. Well, it's one of the most popular Thai desserts, so
Yeah.
I think you're not wrong there. So be sure to try mango and sticky rice this time around too, because
Of
it
course.
is in season
I
right
try
now.
every time. Breakfast, lunch, and dinner.
That's not going to be good for your weight, I don't think.
No, but it's okay. But mango, I think, is very healthy.
Oh, okay.
Rice is very healthy as
But
well.
it's too sweet, isn't it?
No. I like sweets. So for that point, and then you have fantastic soup as well. So your food is quite different from Italian food, of course, but very tasty and very nice, and I enjoy every time.
All right. Okay, I think I've taken enough of your time, and I would like to say thank you
It was a
again for
pleasure.
being on with me on News and Views. Hopefully, I would get a chance to interview you again in the future, and thank you very much.
Yes, with
once again.
some more news by Interaction, Thai, and FIGO.
All right.
Okay?
All right. Thank you very much.
Thank you.
That's it for today, and I'll see you again next week. สวัสดีค่ะ